as Neil mentioned, I'm the clinic director at Hillgreen, and have been honored to be part of Wellspring activities in the past, because Wellspring is such an amazing charity and does so much work for the cancer community in the Greater Toronto area. And it's all free of charge. So it's a wonderful charity. On our registration page, we did have a link. So if anyone feels moved to donate to this amazing charity, please feel free to do so. And it's great to see so many familiar faces today, as well as new ones. Um, there are a couple of Hillgreen team members here. So maybe Carmen and Villawan, if you want to, you can just unmute and say hi so that people see your faces. If you can hear me.
Hello, hi everybody. Hi Pauline. Thank you for coming. Thank you for being here. I think this is a great opportunity for everybody for learning from you, Pauline. So thank you. Thank you.
Thanks, Carmen. Don't feel the need to make a speech, Villawan. You can.
Yes,
are you there?
Hi.
Oh, yeah, there you go.
Yes. Can you see me? Oh, my video is on.
I mean, I can't, but I'm on the screen share, so maybe other people can see you.
Yes,
oh,
hi.
Neil can see you. Okay, great. Go ahead, Villawan.
Yeah. Okay, hi. I'm Villawan. Nice to see you guys here. And Pauline, she's wonderful. So she's gonna share your.
Thank you.
All right. Yeah.
So thanks, Villawan. So Carmen and Villawan are both practitioners with Hillgreen as well. So it's really great to have their input as well. So during the question period, they might weigh in as well. Let's see. I just wanted to explain an acronym that we use sometimes. So just if you hear the words TCM, if you hear me say TCM, that means traditional Chinese medicine. And I have to apologize in advance. For some reason, when I am sharing the slides, there's like a little toolbar at the top. I don't know why. If anyone's a technical whiz, they can let me know. That didn't happen before. Anyway, today we will be covering a few points that are just a basic introduction to traditional Chinese medicine and traditional Chinese medicine oncology, or TCM oncology. We don't have a lot of time, so just a little taste, and then hopefully we'll have time for discussion at the end. So I want to talk about how TCM oncology is used currently in hospitals and cancer centers around the world, and what the view of traditional Chinese medicine is on health and disease, as well as cancer development. So just a little disclaimer and reminder, of course, that any information you get from here is sort of general information, and we can't say for sure that anything's going to be better or worse for you in particular without having done, your own health history and assessment. So if you are in doubt about any of these things, just, contact a traditional Chinese medicine practitioner close to you and make sure you get a personalized assessment. So just a little introduction to myself. So how did I even get involved in all of this? So I actually, my mother got very ill with a rare illness when I was 12. So I became a caregiver at a young age, and I witnessed how a serious illness affects not only sort of part of that person's body in isolation, but their whole body, their whole mind, emotions, spirit, and also family and community. So I became very passionate about how we have to look at the whole person whenever we're dealing with any kind of illness. I also, as a result of some stressors at home due to my mother's illness and some other dynamics, I also went through my own period of burnout, of depression, Bell's palsy, insomnia, dealing with all kinds of health issues. And I found that traditional Chinese medicine was one of the things that helped restore me to a sustainable balance. Then later, of course, having family members who were diagnosed with cancer, as many of us have, I realized there's kind of a gap especially in Ontario, there's not sort of a lot of places where integrative oncology really comes to the forefront compared to some other places in the world. So that's part of why we at Hillgreen are trying to provide the space that we are to say, you know, there's more to you as a person. It's not just your tumor, and there's a lot that Chinese medicine has to offer. So I did end up, after my traditional Chinese medicine background in Toronto, I went to China. I completed a 3-year master's program specifically in traditional Chinese medicine oncology. And that's part of why I'm so passionate about bringing this to Ontario patients. So traditional Chinese medicine, I love speaking about because it's really such a beautiful medical tradition. It is very old. So you can see here, there's some of our historical medical texts and things like that, that they're continuing to unearth them when they do archaeology, but we know that at least from 400 years before the Common Era, there are actual written medical texts. And some of these we still refer to and we learn from, but it has been an evolving tradition. So some people think of it as, oh, that was just so old and we have modern medicine now. We don't need to really refer to some of these really weird ideas that came out before, which is, you know, totally understandable. But just so you know, the traditional Chinese medicine approach has actually been evolving for this whole time. There's been continual, you know, discussion among physicians. There's been learning that's taken place. And then, of course, in the modern era, things have been investigated both clinically through experience as well as scientifically. So there's a lot of research going on right now around the world into traditional Chinese medicine and how it works more from a sort of physiological or biomedical point of view. So it continues to evolve. And this is, for example, the hospital that I interned at in Nanjing. And it's a modern hospital. There's, you know, there's surgeries, there's imaging, CTs, all the chemotherapy, immunotherapy, everything you would get is still in the hospital. But they also at the same time have acupuncture. They've got herbal medicine, acupressure. The nurses will do moxibustion on the cancer patients. I mean, it's really very integrated, which was an amazing experience to see. And it's also taught at the university level. So you can get a bachelor's or master's or a PhD in traditional Chinese medicine specifically. And this whole university in the picture is dedicated to traditional Chinese medicine. There are many such universities. So it is a serious field. You can also specialize in studying the herbs itself from a pharmacy point of view, or you can specialize not in oncology, but in gynecology, you can specialize in acupuncture, you can specialize in nursing from a TCM point of view, etc. This is just to give you a background so that you know that it's not just some superstitious belief. There's actually thousands, if not, you know, hundreds of thousands or millions of people who use this, who study it, who implement it at a professional level every day. In terms of the modality, so a lot of people have heard about acupuncture. That's probably one of our more famous, you know, treatment types. So that would be the insertion of sterile needles under the skin for the purposes of healing. So acupuncture was something we will talk about a little bit more, but it's one of our more common ones to use in cancer patients, in part because it's very safe. So it's been proven, studies have shown that even when cancer patients have relatively low white blood cell counts or platelet counts, acupuncture can be performed very safely. It's best if the acupuncturist is trained in, you know, oncology acupuncture safety, just so we can avoid certain things and we can make sure your blood work meets a certain level. But it is very commonly used because it's not a drug. So it's not going to interact with any other drugs that you're taking. It doesn't carry with it the same risk of side effects as something taken internally. Same with moxibustion. So moxibustion is something we use. So that's the next picture over. That's the burning of mugwort over certain acupuncture points to stimulate the point. So it's actually such an integral part of acupuncture that the Chinese word for acupuncture actually translates into acupuncture and moxibustion. So this is really just part and parcel of acupuncture. It has slightly different functions, but it's part of the whole process, and a lot of people really like the smell. So if you've ever passed an acupuncture clinic and you have this nice sort of incensey smell, that would be the moxibustion. Herbal medicine is another thing that many people have heard of. So that's when you may have heard of ginseng or astragalus, reishi mushroom, or any of those kind of more well-known herbs. We also have hundreds of other herbs. So we have about 300 to 500 commonly used herbs that we mix into formulas specifically for each person. So we see each person as a unique balance, and the tea is generally customized to you. There's lots of different forms of this herbal medicine. If you've ever seen a Chinese herbalist before and you had to take home a big bag of roots and plant parts and twigs and then soak them and boil them and drink them, I mean, you can still do that for sure. But there are some other more technologically advanced versions. So nowadays you can also get it in granules that can be dissolved. You can get it in pills, tablets, etc. So it's very accessible. It doesn't need to be quite as challenging to do as it was before. Cupping, you may have heard of, as many athletes are showing up now with those round marks on their bodies, you know, Michael Phelps, the Olympic swimmer, and all those people. So it is getting more famous. Tends to be used these days a little bit more for musculoskeletal problems, like pain, tension, that kind of thing. Sometimes we can use it for respiratory ailments. And there are quite a number of issues we might use it for. It's something we might use a bit less if there's, you know, low platelets or something like that, or the person's very fatigued from cancer treatment, then we generally wouldn't use cupping as much. But I just wanted to let you guys know about it as well. We also do some acupressure in the ear with these little seeds, or acupuncture in the ear, which can be very effective, especially for things like pain, sleep, stress, post-traumatic stress disorder. And let's face it, for many people, a cancer diagnosis is a traumatic event. So many people do feel either anxiety or some kind of, you know, fight or flight thing happening in the nervous system. It's difficult to sleep, that kind of thing. So ear acupuncture can actually be very effective for that kind of thing. We do our version of medical massage as well, which is called Tuina. We also do the other physical therapies like gua sha or scraping, which is the movement of a tool across the body. And then some of you have heard of Qigong and Tai Chi. So these are sort of self-cultivation exercises, almost like meditative movement. You can think of it as a cross between meditation and yoga, like that kind of thing. I think there's actually a little video. So this is actually from the oncology ward in China. They were doing daily Qigong. So the patients would come out and do the Qigong together, which was amazing. Okay, so you may have heard about some developments in the news. So this one is not specifically cancer related, but in 2015, the winner of the Nobel Prize in Physiology, it went to the development of the malaria drug that actually was extracted from a Chinese herb. And this researcher in particular, Tu Youyou, she actually went and looked at the old books, and we'll look through the old books to figure out how this herb is supposed to be prepared. And that's how she sort of unlocked the key of extracting this medicine. And for that, she and her team got the Nobel Prize. Similarly, there's a lot of developments that have been happening in the field of cancer care. So there's been a lot of research, for example, at Yale for how to use a simple mixture of herbs to complement cancer treatment. So in this case, this is a mixture of 4 herbs, and they've been testing it alongside some chemotherapy. So that's been they're sort of developing a drug out of it, but we also can just use it in the traditional form of the herbs. So what is Chinese medicine oncology? So Chinese medicine oncology is basically a branch of traditional Chinese medicine that would focus on cancer care. It usually requires some advanced training and education. And oncology acupuncture in specific would be how we can apply acupuncture practices within the context of cancer care with a focus on what's been found to be effective and also safety. So safety is always a big concern for people. As I mentioned, there's lots of research going on right now. So some of the research is on specific formulas, what they're doing in the body. Some of it is figuring out sort of more on a practical level if group A undergoes cancer treatment and adds on traditional Chinese medicine and group B just undergoes conventional treatment. Are there any differences in quality of life or in overall outcomes? And we have seen the beginnings of, evidence, like science, so-called scientific evidence for the benefits of traditional Chinese medicine in all of these contexts. So my thesis was specifically on how to use herbs safely and effectively along with conventional breast cancer treatment. It's also, as you may know, unfortunately, it's not as much in Ontario or Toronto, but in some of the bigger cancer centers, let's say in the US or Europe, and of course in Asia, they are researching it and implementing acupuncture and sometimes herbs right in the hospital. So in Memorial Sloan Kettering, Dana-Farber, MD Anderson, they all have been very active in the field of integrative oncology and specifically in advancing the understanding of traditional Chinese medicine for cancer care. So what does that mean? So a lot of people, they may approach us and say, listen, well, I haven't decided, do I want to do my treatment that the doctors are recommending me, or should I just go with herbs or whatever? And usually for us, our approach is actually very integrative. So we say, we don't actually see a lot of strong reason to use Chinese medicine as an alternative. We wouldn't promote it as an alternative to conventional care for the most part. We see it as this field of integrative oncology. That means using a number of tools at your disposal together to complement each other and to get you the best result. Because some tools are best at killing the cells, reducing the tumor, and then other tools might be a bit better at dealing with side effects or looking at the terrain of the body. So looking at your overall immune system. Are you sleeping well? What are the factors that are contributing to your body and mind feeling at its best throughout this whole process? So we see ourselves as part of an overall team, and that's something that's emerging as an idea more and more, not just from the traditional Chinese medicine viewpoint, but other integrative oncology professionals. So if you'll see, this is an example. So this was published in Clinical Oncology as a journal, and it's a graphic or a concept that's taken out of a clinical guideline for traditional Chinese medicine in oncology. So there's a team in Beijing that's put together a couple of clinical guideline books on this subject, and this journal article borrowed from those ideas to map out an example of how traditional Chinese medicine might be used at different points in the process. So let's say the person approaches the doctors with, it's more of a pre-cancerous situation, then the focus, of course, would be on preventing it from developing. So as you can see, the focus of the Chinese medicine treatment in that darker gray box would be to strengthen the immunity and eradicate cancer cells. So basically having a preventative approach at that stage. Once the situation has come to require some kind of surgical intervention, then around the time of the surgery, we may prepare the body for the surgery, strengthen up the body after the surgery, that kind of thing. So that's what this perioperative period is talking about. Also, we may try to address if there's any kind of complications that arise, whether that's pain or infection or that kind of thing. Of course, for serious infection, then antibiotics, but there's many things that herbs and acupuncture can do around the time of surgery. Then for chemo and radiation, we would typically, so a lot of people are concerned, understandably so, with the side effects of conventional cancer treatment, because of course they can be quite strong. Actually, that's not unique to Western medicine. So Chinese medicine sometimes brings out the big guns for something like cancer or another serious illness as well. We do have sort of like more toxic or poisonous herbs, and there's a saying to kind of use poison to fight poison. So we do have that concept historically in Chinese medicine as well. But sometimes we do have to bring out the big guns, and that can be a little hard on the rest of the body. So to complement the chemo and radiation treatment, typically the focus at that time is to strengthen up the body. So, for example, we know that chemotherapy can be very hard on what we consider to be the digestive systems of the body. So you might get the nausea and vomiting, you might get more diarrhea, constipation, there might be low appetite, there might be weight loss, weight gain, things like that. So just as an example, that's something that we could focus on with traditional Chinese medicine when someone is in that kind of stage of treatment. So we'd be reducing the side effects, but we'd be trying to strengthen the body at the same time. So through sleep, digestion, all the things that bring our body more energy. And then after active treatment, people often still might have some ongoing challenges, whether that's fatigue, brain fog, neuropathy, joint pain, that kind of thing. So in those situations, we would be trying to recover the body as quickly as possible by addressing those discomforts and improving the quality of life. And then we would also, you can see that gray box includes the words eradicate cancer cells as well. So that's because when you're outside of the active therapy, then we might use a few more of the herbs that are sort of being researched for their anti-cancer potential. And then finally, when we're more on a kind of maintenance phase, then we would be using those anti-cancer herbs, trying to contribute what we can to slowing down any recurrence. And or if there's metastasis, we'd be, working on just preserving, stabilizing the body as much as possible, and palliating the symptoms as long as possible. So actually, I take a little bit of issue with this diagram, because the palliative of symptoms is something that we would do the whole time. And I think palliative care as a concept is a little bit like underappreciated. So actually, it's something that we can access at any point, not just sort of when there's end stage treatment. So just as a general summary, these are the types of things that we believe we can support people with during treatment. So I try to group them into soothe, strengthen, and slow. So soothing is that palliation concept. So just trying to reduce the discomforts that are most prominent. So the ones that I think Chinese medicine are particularly good at, and I might be missing some, but the ones we see a lot are, mental or emotional discomfort. So anxiety, irritability. I didn't mention depression, but that can also respond well. Insomnia and stress. As well, there's often pain or neuropathy that may come up, and that does respond quite well. So acupuncture is probably best known for pain. But we do see lots of people with neuropathy, and I think Carmen and Villawan would both have great success stories of working with people who've had neuropathy for a long time and have come in, and that's, been relieved by the treatments. Hot flashes and night sweats we see often as well with any of the types of cancer that might be related to the endocrine system, as well as dry mouth, stomach upset, and things like that. We do want to strengthen the body, and this is something that I think gets a little more attention in Chinese medicine than it does in Western medicine or biomedical medicine. And that is because we believe that the body has its own way of dealing with disease, and the more that we can strengthen its abilities, the better for the overall outcome. So we do look at, as I mentioned, digestion as one of the key pillars. So if you can imagine, you might be eating the healthiest food and that kind of thing, but what we want to do is optimize your digestion so that your body can convert all that amazing nutrients you're putting into it as effectively as possible to become those healthy cells in your body. So digestion we see as a key pivot in the body. We also see that we can help to strengthen, as I mentioned, some of those other functions. So the immune system, there actually have been some studies on, different immune cells themselves, and that they've improved after regular moxibustion, let's say, or regular use of certain immune tonics, like the ones I mentioned before. So for example, astragalus or Hwang is one of the more commonly researched herbs, and it is one of those, immune strengthening adaptogenic herbs that can be associated with increased platelets or increased white or red blood cell counts. I think I've more or less covered the other ones. There have been, so in terms of slowing cancer growth, of course, we don't want to make lofty claims. I try to make sure everything is realistic in terms of expectations. And if I had a secret, all-round cure, then I think you probably would have known about that by now. But we work together considering cancer is many factors put together, and that we can definitely support the quality of life and for people to have as much, enjoyment and slowing down the either progression or recurrence as much as possible. And there have been these studies that are kind of interesting. So there's not a lot of funding for randomized controlled trials into custom herbs the way we usually practice it. But there are some countries such as Taiwan that are a very interesting place to study. And the reason is that Taiwan has a national database for their healthcare, and that includes all the medications and diagnoses that the person has from the sort of conventional or biomedical point of view, but their health coverage includes Chinese medicine. So you also get in the same database all of the herbs that person is prescribed. So there have been a number of studies that have analyzed this database and have found that that people who take Chinese medicine do tend to have better outcomes in a number of different forms of cancer. So it's an observational study. That means that those two things are correlated, taking the Chinese herbs and generally, having a slightly longer, life expectancy and having better quality of life. So those things are correlated. That means there could be another cause. So that's the problem with correlation studies. But it at least is promising and at least shows that we're not doing anything terribly bad by having Chinese herbs, right? If anything, it's beneficial. And there have been a few randomized controlled trials as well. So there's a team in Beijing that's partnered with a group in MD Anderson Cancer Center in Texas. And they've done a number of randomized controlled trials, more in colorectal cancer, but that have also found that there's a better life expectancy correlated with a longer use of traditional Chinese medicine herbs during and after treatment for the cancer. So these are sort of beginning and promising studies. In terms of for acupuncture, does acupuncture really work? Well, there have been some studies in that as well. So, for example, there's a famous point that we often use to affect the digestive system. And the picture in the bottom right is trying to say that when you stimulate that point, that there's actually more activity in the stomach and in the gastrointestinal tract when you use that point. So these things that people sort of figured out empirically over the thousands of years are now being researched and to a limited extent proven by modern scientific research that we see there actually are correlations. There's also, of course, been studies on the effectiveness on different symptoms. So you can see it has helped with pain on average, and it also, you can see the activity in the brain that shows up when you stimulate different acupuncture points. Okay, so probably more interesting to a lot of you is, well, what does traditional Chinese medicine think about health and think about cancer in general? So, of course, there's many things I could say about this, having done, 3 years of full-time study on it. But just as a brief kind of almost analogy, it's an analogy. You can think of sort of a biomedical viewpoint a little bit more, it's a little bit more mechanistic. It's a little bit more like our body's kind of like a car, you try to figure out which part is broken or what mechanistically is going wrong, and you try to replace that part or fix it. And then you keep the mechanism going as effectively as possible. And then the more Chinese medicine, or some would say kind of like a more Eastern view of health, would be a little bit more organic. So looking at the body as a garden. So you look at it as, first of all, there's a lot of interconnection. So it's a natural process. There's many factors, and we're part of the natural environment. So anything may affect us, from food to sunlight to our emotional interactions to that kind of thing. And some of those are under our control, like what I put into my mouth right this second is under my control. Some of those things are not under my control. So genes are a factor. So certain things that maybe we ate when we were a child or whatever, or a disease that we came down with when we were a kid, or that kind of thing, an infection that we came across, maybe that is not under my control. So, but we do take into account everything, and we look at the importance of cultivating the state of the garden. So we think of health as something we can cultivate, not just something that we fix when it's broken. We think of how do we maintain the optimum balance in the body, so that our body's own amazing ability to balance itself is the strongest. So how do we apply that to cancer in particular? Would be, I wanted to share these kind of like 4 main factors of cancer development according to Chinese medicine. So these are 4 factors that will come up if you look at any of the kind of modern textbooks or whatever on how traditional Chinese medicine understands cancer. And there are 4 factors that we consider when we work with anyone. Okay, I just need to have a sip of water. All right, so the first one is called Zhang Qi deficiency. So what does that mean? It's sort of related to this concept that we've touched on, which is that we believe there's ways to cultivate the body's own strength. So some people think of it as a sort of an analogy to the immune system. So if you can imagine, the immune system is kind of supposed to detect cancer cells and destroy them. But for whatever reason, when cancer has developed, then the ability of those cells to spread, that has grown stronger than the immune system's ability to detect them and get rid of them in time. So our own body's qi is important, and we can cultivate that in different ways. So, for example, the qigong that I talked about earlier, that's actually literally translates into the mastery of your qi or the cultivation of your qi. So those practices are supposed to be, and I know Wellspring has these amazing qigong courses or classes from time to time. So I encourage you all to check those out. But qigong through different herbs, we're going to talk a little bit about how to do that. So our theory is that in any case where cancer has developed, there is some amount of qi deficiency, zheng qi deficiency. For some people, that may be more prominent. For some people, it's a smaller factor than one of the other factors, but it's always a factor. Another factor we think about in the development of cancer, according to Chinese medicine, is stagnation. So that means, I didn't, I think I took away the slide where there was those lines all around the body. So when you look at an acupuncture diagram, you see all these lines going down the person's, I think there's like a doll actually in Carmen's screen behind her head. So if you see where Carmen is, you'll see one of those acupuncture dolls, and there's lines all over the body. And so those are called meridians. So those are the main energy channels that we would use when we select different acupuncture points or acupressure points for you to do on yourself. Yes, thank you, Carmen. So one of the factors in cancer development in all cases would be there's some kind of blockage, there's some kind of stagnation of the flow within those channels. Sometimes it's very obvious, where the tumor is. There's usually a blockage there of some kind. Things are not flowing. But I want to make sure that you all know that this is when Chinese medicine looks at the body, we don't just look at the physical. So it's also like there might be a blockage in how almost like the energy flows in that area without there being a physical blockage in the blood vessels or whatever. So if you have questions, please let me know. But yeah, so that map is not of the blood vessels or the nerves, but you can kind of think of it in that sense. Like there's things that are supposed to circulate around the body at all times. And there's been some kind of stagnation in order for cancer to develop. The third factor in cancer development would be what we call phlegm damp. Now, this is a bit of a weird concept. It's a bit hard to translate because for us, phlegm damp can be physical. You can actually see there's a lot of mucus in some organ, or there's mucus in the nose or whatever, or there could be lumps, so nodules typically, and tumors, and as well benign tumors like fibroids and things like that. Typically there's some kind of component of this kind of energetic mucus or energetic or physical mucus. Bumps, lumps. It can also manifest in joint pain, and you can kind of think of it sort of like inflammation. So typically when there's phlegm damp, there's inflammation somewhere, joints, respiratory, something like, or in the digestive system, something like that. So that's how I try to translate it into like a more biomedical concept. And again, I'll talk in the next few slides, like what to look out for and what we can do as a self-care to try to minimize these things. And then finally, the fourth factor that we always see when cancer is developed is some element of toxin. So for us in Chinese medicine, this toxin can be external or it can be internal. So we have seen this in sort of the biomedical view of cancer as well. So sometimes cancer is related to an external toxin, like a pathogen, like a viral infection or exposure to an environmental contaminant of some kind. So that can be part of the trigger of the development of the disease. What we don't elaborate on that much in biomedicine, but is true in Chinese medicine, is that toxin can also develop internally. So anything that's kind of left to fester to the extreme becomes a toxin, and that can be either an unhealthy physical balance. So as I mentioned, Chinese medicine thinks of us as a garden, as part of nature. So we literally talk about, is there cold in this person? Is there hot? Is there dampness in this person? Is there wind or dryness? And if any of those things has gone to the extreme, then it can become a so-called toxin. Emotionally as well. So emotions tend to create either like an extreme stagnation or an extreme heat or something like that, typically. So they can also become toxic if we hang on to them for long enough. So the causal factors for all disease, according to Chinese medicine, not just cancer, include those factors at the bottom. So our emotions are a factor, genetics are a factor, diet, lifestyle, infections, injuries, environment. So what can we do? So here's the point where I'm trying to share a few little tips. So just again, FYI, this is very general. It's not, if you want more specific, then you're gonna have to ask us because every person's different. But no one's gonna be harmed generally by following these general tips that I've collected. So how do we improve our zheng qi? So that's the first point I mentioned, where our own qi is weak. So I think we're an overtired society. I do not blame us each individually. I kind of blame capitalism, but that's another conversation. So we are an overworked society. People do not rest nearly as much as I wish they could or would when I'm their practitioner. So resting a lot, I mean, and sometimes I see people in treatment and they're like, oh my God, I have to sleep like 9 hours. This is like terrible. And I was like, well, yeah, but you probably were in a sleep deficit before, and plus chemo is exhausting. So maybe you should just sleep the 9 hours and like take the nap when you need to take the nap or whatever. I think resting is important, and we can kind of get used to getting by on adrenaline or cortisol, just like the hormones that get pumped out when we're under stress. And we can get used to getting by on coffee. But it's important to do as much as we can, given the realities of life, to set aside that time to take it easy, to let things go, to say no, and to really just let our body be. Also dressing properly. Point number 2. I remember when my Chinese medicine doctors, when I was younger, went on this little rant because she was like, people in Canada don't wear long johns. So a lot of times people are not dressing as warmly as we would like them to dress in Chinese medicine. It takes energy to heat the body, and especially the lower part of the body. It's important to protect it and keep it warm as well. Our necks and other parts of the body that are exposed to the cold, we don't really like overexposure to the cold, and that includes cold foods. So that's something, if I don't mention it later, let me mention it now. Exposure to the cold through food is also a little bit discouraged when you have qi deficiency, because it takes that extra energy to heat your food up to your body temperature and then to process it more. So it's just like taking extra energy out of you. Whereas if you are able to lightly steam it, chew it thoroughly, it's so much easier on your body to process. Let's see, warming the legs and the low back. So that's part of that, those key areas for protecting our qi. Sleeping early, that's kind of part of resting, but it's sort of time specific. So if we're asleep by 11, that's ideal. Exercising moderately. Sorry, I'm just going to try to move. I can't seem to move this, so I can't read my slide. Okay, so when we're deficient in qi, then sometimes vigorous exercise is too much. So moderate exercise, walks, yoga, that kind of thing. So exercising according to the level of energy in your body. Sometimes people just really overdo it and then they get discouraged from exercise. They think they don't have the energy. But even just starting moderately and slowly building up your stamina is important if you feel your qi is low. Washing our hands. I mean, that's just to protect qi robbers, such as viral or bacterial infections. Oh, I did say avoiding cold and raw foods. Didn't see that because it was covered by my screen where I see all of you. And then doing moxibustion is another way to build the chi. So that's that burning of the herbs. So that's actually something you can do yourself. There are sticks of it that you can use at home, and there are specific points that you can use. So that's what I was mentioning. Is there are even some studies where doing the moxibustion over certain points has been helping with blood counts. So that's something that we can teach you to do. And then I mentioned qigong already. Okay, in terms of this, and then sorry, at the bottom, there's just some pictures of herbs. So these are some of the ones I mentioned, like astragalus and reishi mushroom on the right. And then goji berry is another common one that people have heard about as a superfood. The other ones are probably less famous, but they're still good for building the chi and would be included in a chi building formula that we make. Stagnation of chi and blood. So as I mentioned, prolonged emotional stress or emotions that we hold on to in terms of resentments and things like that can create a stagnation in the body. So managing that stress, and again, Wellspring has lots of these amazing programs, meditation or art therapy, that type of thing. So different ways that we can manage our emotional stress help for the chi and the blood to flow. Also, interestingly, one of the reasons that our chi gets stagnant is that we are unable to express ourselves. So there's this sense of frustration. So actually, the creative pursuits, feeling like you can find and value spaces in which you feel your voice can actually really be heard. You can be yourself, you can be authentic and express yourself. You can be creative, and that can come out. That can really help your chi from becoming stagnant. A lot of people, so this could be a generational or cultural thing, but some people are very reluctant to seek professional support around different emotional issues. I do encourage it. I think anyone could probably benefit from having an objective third party help them work through old standing resentments. So I don't know if any of you have read the book Radical Remission. So it's a book written by someone who, I think Kelly Turner, maybe. She did her PhD interviewing a lot of people who beat their so-called beat their prognosis or whatever, like had a radically surprising result with their cancer treatments. So she identified 9 common factors that all of these surprising people did. And one of them was they did find ways to let go of old negative emotions. I forget how she worded it. I think it was let go of negative emotions, cultivate positive emotions. Those were 2 separate factors. Taking herbs and supplements was actually a different one, radically changing their diet. So all of these things are actually, that I'm talking about, are things that show up in her research as well. So anyway, I do encourage people to consider if there's anything you're not at peace with, there's lots of ways to deal with that and let go, feel lighter, and feel that chi moving a little more. Physically as well. So like I was saying, the regular exercise, and then stretching in particular. So if you're the kind of person who just pumps iron, that's great, but there could be stagnation developing just because those muscles are sort of like tight. So the stretching, the qigong, that moderate stuff, yoga, can also help the chi to just flow a little bit more. Getting treatments as well, so body work, massage, acupuncture, that kind of thing, can reduce that tension. And then in terms of diet, we think about the greens. When we think about this issue, we think about greens, we think about herbs and spices, basil and mint and stuff like that, or even cumin, turmeric, some of those spices that you see down there below. And those overlap with some of the herbs that we would also use for chi stagnation. So the phlegm damp thing that I was mentioning is sort of analogous to inflammation. So for any of you who've gone to Wellspring's programs on diet or other programs on anti-cancer diet, typically an anti-inflammatory diet is recommended. Of course, the most studied one has been sort of a Mediterranean diet, for those of us who are not from the Mediterranean, then maybe we have to adapt it to our cultural, food preferences. But generally, looking at, what would be a good anti-inflammatory diet and avoiding these main allergens or in what or inflammatory sources, or they're pretty much the same as what Chinese medicine would consider foods that create phlegm and damp. So that would be, sugar, dairy, greasy foods, alcohol, and anything rancid. And for Chinese medicine as well, we still consider sort of cold and raw foods as possibly creating this phlegm and damp, whereas that might not show up on a general anti-inflammatory diet. And then how we also think about how we eat. So a lot of people maybe know what to eat, but they're still eating in a rushed manner under great stress, or they're stressing about what they eat because they're a perfectionist like I am. I understand. I'm a recovering perfectionist, so I get it. But you try to do everything perfectly, and you're trying to do your diet perfectly too, and it causes even more stress. So we say, you know what? Enjoy your food. It's important to eat in a relaxed manner. It helps the digestive system slow down. It's not just like, can I eat this really bland broccoli for the rest of my life? It's also finding ways to balance that anti-inflammatory nature with actually just appreciating that moment and appreciating that food and having a good relationship with eating. So that the emotional component again comes back to be important for us. And then finally, we will have less phlegm and damp if we do exercise regularly. So maybe you see a theme in all of my slides mention some kind of exercise. But generally it does help with that inflammation too. Yeah, so then you'll see there's a few herbs below as well. So for example, on the left is Job's tears. Job's tears they actually did a bunch of research on that in terms of extracting the oil and researching the anti-cancer properties of that. That's basically a Chinese barley. We always, if you're going to have a grain like barley, depending on what diet you're on, go for a whole one. So a whole Job's tear, that's great. I've also got, I think those are aduki beans there. That's also seen to be good for dampness in Chinese medicine. Mung beans are good as well. Seaweeds of different kinds. It's nice to have a variety of different seaweeds in the diet. They're seen to help to soften up those phlegm, like nodules and lumps. And mushrooms, like regular mushrooms, are even said to be good for phlegm as well. And we know that mushrooms have a lot of strong medicinal properties as well. And finally, I'm rushing a little bit so that we have time for questions, is that toxin stuff. So as I mentioned, sort of addressing anything that might have gone to the extreme in you. If you can't see it, then ask a professional, ask a friend to help reflect back to you what's gone to the extreme. And then as well our environment. So there's some good resources out there on how to minimize our exposures to environmental toxic sources. I've got one website there, for example. That's not my website, that's the Environmental Working Group. They've done a bunch of, what's handy about the Environmental Working Group is they have a bunch of consumer friendly downloads. You can download a list of chemicals that might appear in your shampoo, and you can go to the store and say, oh, does my shampoo have this or that or whatever? And it can help you to just minimize any potential exposure to a chemical contaminant. There's lots of chemicals that are sort of under research for their effect on the body. And sometimes it takes a big fight before they're actually like labeled as this is carcinogenic or whatever. But those of us who are sort of consumer-based researchers, we may sound the alarm a little earlier than the government agency declares that they're off limits. So this has happened with, BPA and things like that. So that was a consumer fight. People were trying to ban BPA from certain plastics and that kind of thing. So as well, using a water filter, such as, a reverse osmosis or a Berkey water filter, because some of those chemicals or pesticides might have leached actually into our water source. And as well, the water that's coming just, through our water system, sometimes there's microplastics and things like that in it due to what we've done to the environment. So just making sure we're not exposed to that more than we need to be. The environmental working group is also the people who put out the list of dirty dozen and clean 15. So we know, for example, many people say, oh, well, let's minimize our pesticide exposure, but then organic food is so expensive. Well, you can look at those lists because let's say it's on the clean 15. That means it has a relatively low level of pesticides already when it's grown conventionally. So if you're on a budget, then those would be the ones that, you know, it's not that as big a deal to buy it non-organic. Whereas the dirty dozen are the ones that have been found to have the most pesticide residues. So those are the ones you'd want to prioritize getting organically, for example. Okay, and there's some references for you, and I finished, oh, exactly at 8 o'clock. So I was hoping to finish a little earlier to have a few more minutes for questions, but I'm happy to answer them now. And just before I forget, because I know some people will probably have to leave right on time, let me just put in the chat, we have a feedback form. So even if you have to leave early before all the questions are done, we would really appreciate it if you take 2 seconds to just go fill in the form. If you want to, you know, ask any further questions or whatever, you can put it in the form as well, and I'm happy to email you back. So there's the form. Oh, thank you, Neil, for sharing those links.